Upper blepharoplasty, also known as eyelid surgery. How is it done? Well, today we're going to look at this with some 3D animation. So without the graphic detail, we can really see how upper eyelid surgery is done. Hello, my name is Dr. Julian de Silva. I'm a board certified facial cosmetic surgeon and my practice is in central London, Harley Street, and I specialize in only facial procedures. Well, a common characteristic of the upper eyelid is facial aging in this area, and that can be apparent with loose skin, with puffiness like fat creeping forwards, and of course there are other considerations looking at this kind of fine detail. So in terms of the surgery, well, the anatomy is kind of key to this area. And so anatomy in the upper eyelid, well, it consists of several different anatomical layers. You have the skin, which is the most superficial layer. You have muscle that sits beneath that. Then there's a fibrous tissue, the orbital septum that sits beneath that. And then we have a cushion of fat that surrounds your eye, and often with natural facial aging, some of that fat creeps forward, pushing forward the orbital septum and creating a bulge in the inside corner of the eye. So the next part of this is administering local anesthetic. Sedation anesthesia, I often complete eyelid surgery under sedation anesthesia. And the reason being, sedation is a wonderful form of anesthetic because it's very safe, patients recover very quickly, and it takes away the anxiety and stress of undergoing a procedure. What sedation actually means? Well, it means you sleep during the surgery. So you're still breathing yourself, all your kind of natural protective reflexes are working normally, you're just sleeping. A bit like you do at night, however, it's brought on with medicines. So while under sedation, well then I would put some local anesthetic into the skin around the upper eyelid. Now this local anesthetic, if you weren't under sedation, well it would certainly sting. So having it under the sedation just makes this comfortable. Now once the local anesthetic is applied, it will work and it will reduce discomfort even after the surgery, and it will also reduce things like bruising. In terms of the skin, well, it's very important in my opinion to mark the skin with you sitting up. And the reason for that is you look different when you're lying down. And so although the surgery is completed with you lying down, I would always spend time marking this area before the surgery in order to get the best results. Now, key is to remove the loose skin, but not to overdo this. It is so important to meticulously measure the loose skin to ensure that you can close your eyes after the surgery. Now, once the skin has been removed, there's this cushion of muscle beneath the skin. For some patients, it may be indicated to take a tiny amount of this muscle away. This will tend to open up the eyelid more and give you a more open eye appearance, which will look natural, which will look refreshed. Now, in certain people, it may be necessary to modify this surgery. If you have any dry eyes, if you have any other potential issues with your eyes, it may be best to avoid this in order to give you the best results. In some people who get a lot of crow's feet, well, it may be advised just to fine tune the removal of the orbicularis muscle because that will benefit you further. After this step, we look at the inside corner of the eye. And the inside corner of the eye, there's often this cushion of fat known as the medial fat pad that's pushing forwards into the skin. And this creates a fullness in this area. So I would generally reduce this area by reducing some of the prominent fat. And most people, when this is reduced, will give a very natural and fresh appearance. Now, in other parts of the eyelid, it's very important to preserve that fat because that gives a natural fullness to the eyelid. And so often I'll preserve the fat in this area. However, every single person is different, and some people do require reducing that fat in order to give the best results. And that would certainly be the case in Asian upper blepharoplasty, double eyelid surgery. Sometimes it can be important also in ethnic Afro-Caribbean or African blepharoplasty to get the very best results. Now, there's so many little nuances when it comes to eyelid surgery. Sometimes in this outside corner of the eyelid, the lacrimal gland, which gives you tears, which avoids dryness in the eyes, sometimes that gland can have slipped down with gravity. It is important to stitch that up to where it used to be. Now it's important that that isn't removed, because removal of that will potentially cause dryness in the eye. So it's very important to preserve this natural anatomy. So after this, well, we'll look at suturing, and the stitches are very important in this area because we want to hide the scars from the surgery. Now I will generally place the skin incision and scar in the natural crease of the eyelid. There's often some degree of asymmetry between the right and the left side, so I will look to match that before the surgery. The stitches are important because we want the finest stitches to give the finest scar. Now, in terms of science and research, we know that using a stitch that is removed after 1 week, in other words, a non-dissolvable stitch, gives the least amount of scarring. In a way, it's a quicker fix to use a dissolvable stitch because that doesn't need to be removed. However, in some people, when that stitch dissolves, it can irritate the skin and it can result in a more prominent scar. So we definitely want to use non-dissolvable stitches because that will give the finest and most difficult to see scars. Now, generally speaking, these scars heal really well and they're difficult to see. Now, the next stage is, in some people, I would look to resurface the skin. And the reason is, although we can remove some of the loose skin with surgery, we can't remove all of the loose skin, and often there's fine lines and wrinkles in the remaining skin that change the texture. So then we can use a laser, we can use regenerative medicine, platelet-rich plasma to improve the quality of the skin. It can improve the fine lines, it can improve the pore size, and generally it will smoothen over that surface of skin and make it look more refreshed. And that can be really important in Caucasian and certain ethnicities because it will really give a better result. And then the final thing is, I would often put a tiny amount of local anesthetic in this area so that it's really comfortable after the surgery. So although I give every patient a prescription with some analgesia, more than half my patients, they never need the analgesia because it's never required. And so we can see with before and after pictures what upper eyelid surgery or upper blepharoplasty does is it opens up the eyelid so you can see more of the eyelid afterwards, and that creates a rejuvenated appearance. It makes the eye look fresher, it makes the eye look more open. Care is required in men as opposed to women because less is more. You don't want to change this area too much in men because it could feminize a man's appearance. However, this is an area that often just seeing a little bit more of the eyelid will just freshen up a person's appearance and give them a more rejuvenated look. I do hope this information has been helpful for you. Thank you for watching.